Today we're talking about heart rate variability and Vegas, baby. We're not talking about that city in Nevada. We're actually talking about the vagus nerve. So when we talk about heart rate variability, you may hear that word or even the vagus nerve. Super important words, both two things that are synergistic and also are what we're going to say working with the nervous system. And it is something that we really want to look at as we look at longevity, as we look at how our body recovers. Now, heart rate variability itself is the time between each individual heartbeats. And why this is important is because it actually is a good indicator or a tool that actually measures our stress levels. It measures how healthy we are. It measures also how we are in a state of rest and repair. So it's governed by what we call our parasympathetic and our sympathetic nervous system. Now, that is what we call part of our autonomic nervous system. Again, we've got a couple different fancy words out there, but anytime you hear the word autonomic, I use the word automatic. These are the things that we don't have to think about. Things like heartbeat, lungs breathing, as well as digestion. That is what our autonomic functions are doing. So when we look at those, and again, we're looking at the two different nervous systems that work oppositional of each other, meaning the sympathetic, which is our fight or flight. You know, we're in a crisis, we run, or, you know, hey, we fight, or we're looking at our parasympathetics, which is our rest and restoration, or what also is known as digestion system. That is our more calming. From a standpoint of health, we want to be more into the autonomic system. Now, again, with heart rate variability, we're looking for a number. We want to have a high score on that number because we want to have a good high number because that's an indication that we're actually functioning in our parasympathetic nervous system, where our body's actually able to rest and restore and recover. So a lot of athletes actually look at their heart rate variability and they use tools like their Apple Watch or a Swoop or a Whoop strap or a Garmin or Oura rings or different devices like that can actually assess their HRV and look at it on a pretty consistent basis. And they're going to look at that and see where they are, whether they're overworking themselves in terms of their exercise or whether they need to maybe step it up a little bit more to actually engage their system to actually help bring those numbers back up, help bring their body into a better state. So again, we look at different things with the heart rate variability. Again, we're looking at how that controls that. The biggest factors that really affect heart rate variability are stress, and that can show up in all different shapes and forms. We look at poor sleep. That's another big thing. Poor diet, those different things. So again, having a sedentary or lack of exercise, those are big factors that can definitely affect it. And as we look at our Western culture, a lot of times we can fall into that category pretty easily, or maybe even the winter months. So as we're running into the spring and we're seeing people being more active, these are good things to really consider in what we want to do. So an ideal number for, I'm going to say, your heart rate variability, and that can change with age, because definitely as we age, we definitely see our HRV definitely decreasing, or what you would say is your average number would start to drop off a little bit. So as we age, we want to keep working harder to actually progress that number up. So there's different things that we can actually do that can actually improve that. So the things that we're going to do are, first things are, we're going to exercise. We're going to reduce our stress. We're going to eat right, get good exercise. We're going to get good sleep. We are going to limit our alcohol and caffeine. We're going to do practices like rest and meditation, maybe some good stressful, just relaxation, whether it's in prayer, whether it's in yoga, doing different things that'll actually help to mitigate those stress. And the one thing that we're also going to do, or what I'm going to encourage, is getting adjusted. Getting a chiropractic adjustment, and why that is so important and how that can impact and affect HRV. So hi, I want to introduce myself. My name is Dr. Sweeney, and I've been practicing this little known technique called the NUCA method here in Austin for over 20 years. And the unique thing about the NUCA method is it's a very unique chiropractic adjustment that entails no twisting, popping, or cracking, and it's very specific adjustments that we do into the base of the neck or the base of the skull. And what we are looking to activate by adjusting our specific vertebra that we work on are actually your parasympathetic nervous system. We actually are working with those nerves to actually activate those. Now, as we're doing that, we want to have a positive influence on things like our vagus nerve. Now, our vagus nerve is one of the 12 nerves that actually comes out of the spinal cord right through here that actually has multiple functions. They actually call the vagus nerve the wandering nerve because it does so many things. It does things like activating our esophagus all the way down, so it helps with digestion. It helps open up all the little different valves, which can actually create things like heartburn and reflux. It governs the heart in terms of the heartbeat regulation as well as its tempo. So if we're having tachycardia, meaning accelerated heart rate, or irregular heartbeats, PVCs, those types of things, hey, we maybe need to check out our HRV or looking at our vagus nerve. It also innervates the gut, meaning all of the nerves within the stomach are innervated by, as well as the intestines are innervated by the vagus nerve. So if we're having issues with either hypergut motility, meaning it's moving a little bit faster than what we'd like, or slow gut motility, meaning maybe we're a little constipated or feeling bloated, then maybe we need to check out that HRV and look at the vagus nerve and how it's functioning. And that's one thing that we can actually work with. So it's super cool in how when we can work with the nervous system as chiropractors that we can actually see a positive change. So super cool. One of the things that we do whenever we make assessments on folks is we take 3 very precise x-rays of the head and neck area to look and see what's going on 3-dimensionally. We do a thorough examination, looking, delving in deep with the history, finding out. We look at posture assessments. We look at all number of different metrics, biometrics, understanding what's going on with the human body and how the nervous system is actually functioning. And we want to see a positive functioning nervous system, and we want to see a nervous system that's functioning more into that parasympathetic, that's actually creating that rest and restorative state and helping to bring people back into a better state of healing and longevity. So again, some great things that you can be doing at home. Again, increasing your exercise. Those are some great things. We're going to look at our diet. We're going to limit our alcohol and caffeine. Those are great things to start with as well. Getting good sleep, making sure you're getting a good solid 7 to 9 hours a night. Again, doing those prayerful or restful things that we can actually doing, meditation to actually help bring down that nervous system, bring it into a calmer state, and then getting adjusted. So, if you would like to talk to us, we would be happy to, set up a time where you could actually call us and do a free consultation and have a conversation with what it is that we do and how we may be able to help you. Again, you would just reach out to our office and we'd be happy to set those things up and find out how we can increase your heart rate variability and help you have a more happier, healthier, and better longevity in your life. So until then, farewell, be well, and be grateful.